55-year-old male with a past medical history of end-stage renal disease on dialysis now presents to the hospital due to missing dialysis. Happens all the time. He has not been compliant with it, and you notice that the patient's hemoglobin is low at 7. He denies blood in the stools, melena, and a cold blood is negative. See how it's a recurrent thing. So any patient who comes with anemia, two things that you need to check kind of right off the bat. Retic count, is the bone marrow working? And a cold blood, is the patient losing it? This is almost like, when you see patients with acute kidney injury, you check their urine, you check, urine creatinine, urine sodium, just kind of stuff, right? Is the patient peeing? It's just stuff right off the bat that you need to check on every patient. So retic count, GI bleed with a guaiac. Basic stuff, just get that out of the way. So in this patient, end-stage renal disease, and he denies blood, stools or melena, and a cold blood is negative. You rule that right off the bat. The patient is not bleeding. You don't need to go in the route of getting GI to come and do a colonoscopy and endoscopy. The patient's hemoglobin is 7. Why do you think the patient is anemic in this case? All right. In order for you to know why the patient is anemic, you got to understand some physiology. So how erythropoiesis takes place is that the kidney and the liver release a protein or a hormone. You can call it's called erythropoietin. Erythropoietin goes to the bone marrow and says, hey, we need more blood. Okay. And the kidney feels that. So for example, when there is decrease in blood supply to the kidney, and the kidney says, wait a second, there is decreased blood supply, let me release more erythropoietin. It goes to the bone marrow, causes the bone marrow to make more blood. So when you have end-stage renal disease, you don't have the kidney working. Therefore, there is no more erythropoietin released. Therefore, the bone marrow doesn't produce any blood. In this case, the bone marrow has all the capacity to make blood. It's fine there. You might have anemia of chronic disease on top of that because of the kidney issues. You might have some other issues going on. But at the same time, one of the main problems I want you to be familiar with in end-stage renal disease is that the kidney is just not releasing erythropoietin. So what do we do about that? So in cases like this, we actually give the patients erythropoietin. This comes in medications like Procrit or Epogen. So in these medications, you give the patient erythropoietin to stimulate the bone marrow to make